Now, your lordships and your honourable members, Bismillah ar-Rahman ar-Rahim. John, a few words about, because it's important to just remind people that 25,000 British citizens go for Hajj, approximately between 20 and 25,000. Over 100,000 visit on an annual basis. And it's important that we remind people not only their rights but also their responsibilities, to awaken them, to make them aware of what to expect in terms of health and safety. I want to say thank you to British Hajj Association, who have been committed. The whole team, Khalid Pervez and all his team have been committed for the last 12 years that every year they go around the country without any money from government, without any government from anybody else apart from the maybe National Health Service, who've given them some support in relation to meningitis awareness. It's very important that people are aware the importance of meningitis, jabs, the importance of preparing first in time, mentally, but also making sure that they don't fall in the hands of a very small minority, occasionally agents who take their money and then do a runner. I usually seek services from Shakil Nabil Tours, who have been excellent. And that's why I need to say this, that the majority of people who provide services have been excellent. He doesn't give me any discount, by the way, for saying that. But he provides an excellent service. There are many others who provide excellent service. And it's important to mention those people who provide excellent service, but also to mention that be careful. There are some horrible people out there who have been prosecuted in the past, and we want to thank the authorities, the police, and also consumer protection, who've taken legal action against those people. So with that very short introduction, I'm going to ask my friend Phil Hunt, Lord Hunt, to say a few words, Deputy Leader of Labour Group in the House of Lords.
Well, thank you very much indeed, Lord Ahmed, and it's a great privilege to be here today. I'm sorry I can only stay a couple of minutes because we've got some debates in the House of Lords this afternoon which I'm taking part in. It was 12 years ago that I first attended a meeting of ABH in Birmingham, where the first health and safety meeting was held. And it is amazing to me how much progress has been made over those intervening years. And as a result of the work of ABH, thousands and thousands of our fellow citizens have gone safely on pilgrimage and returned and have received great encouragement as a result of their experience. And I think we owe a huge debt to ABH for the work that they do. But we can never be complacent. And the message around health and safety, I think, is as important today as it was in 1999 when you first started. I also want to say that the point that's been raised about travel arrangements and tour operators is one that is very well made. I remember in Small Heath 2 years ago when you held a meeting for pilgrims who had returned, where they were talking about their experiences, both good and bad. And I was very struck then by the evidence that were being given by pilgrims as to the unscrupulousness of some tour operators. Now, as we've heard, it's very unfair to tar all tour operators with a bad brush, because many of them are very reputable. But there still remains a major problem. I know that you've been in discussions with a number of government departments about this. I believe government could be more proactive. I will work with you to ensure that we do encourage the government to be more proactive. But I think the key message is that the work of ABH has been absolutely amazing over the last 12 years. I'm very proud that it's based in Birmingham, and I just wish you every success for the future.
Thank you very much. And I would like to listen to you, Dr. Saab.
Thank you very much. Thank you very much. Bismillahirrahmanirrahim. Ladies and gentlemen, respected guests, first of all, I'm a GP from Birmingham, and I'm a member of the ABS for the last many, many years. So every year, I come with them over here and also in the Birmingham and other cities. I talk about taking some steps before you go to Saudi Arabia so that you can have good health, enjoy there. So certain things I tell all you. Here, even while in Birmingham, we get a big gathering of the Hajj going to Saudi Arabia and talk over there. As Lord Saab said that 125,000 people, Muslims, went each year to Saudi Arabia for Hajj as well as Umrah. So we try our best to give the maximum information, how can you have a good health over here. So that's the way I come over here to talk about it. First of all, I advise the people, you must see your GP 4 to 6 weeks before you go to Saudi Arabia and discuss all your health problems with the GP. Because when they're talking about that, there are certain problems or health issues like a TB. Those people are advised not to go for Hajj because active TB, that's the trend there because too many people over there, it's a droplet infection. You cough, you talk, you sneeze, you pass on the TB to other people who are healthy people over there. And sometimes in tent, you're sleeping like in a row. You're 20, 30 people, and you start suffering, you keep on giving them. So they are advised not to go for the Hajj and wait. They get their treatment, get better, healthy, and next year, after that year, they can go for Hajj. Second, those chronic problem. Some people suffering from diabetes, some suffering from blood pressure, some suffering from asthma. Those chronic illnesses, they must see their own doctor. And they must get all the medicine for 4 weeks, they're saying for 4 weeks or 6 weeks. They must take their medication with them. Because medications are very costly over there in Saudi Arabia. When you buy them, you can have from your GP, free of charge mostly, and those people who don't have to pay. So must make sure you got your all medication with you instead of going there without medication and coming back more seriously ill. So it's not advisable for them. So all the medication we talk to them and tell them they must take all these things. Third thing we talk about that the people who have a dental problem or who have an eye problem, these glasses, they can break, you must take a 2 glasses, pair of glasses. They can be useful. Check with your dentist if you had any problem of your dental problem, oral hygiene, the dentist will explain to you and tell you what you are going to do for next 4 to 6 weeks while you are still here. So get your advice, prepare yourself, and get ready because it's not an easy job doing Hajj. 5 days continuous, the thing you are doing, you're moving up and about, it is a really very hard thing. And you have to prepare yourself and your health to stay healthy over there so that you can perform your Hajj. If you got ill there, you will lose your Hajj. The best thing is prepare yourself in every aspect so that you can perform your Hajj. Next thing is that, which I talk about the ladies, ladies usually, we advise them as a GP abstain because certain ladies get the period during that time. So they have to delay, they have to avoid to have the period those time. They must see the GP, he can give some, some treatment, keep it, you to do it, and the period can be delayed, and the sister can perform their Hajj safely. So that's another thing. Apart from that, we give the general advice about, because it's a 5 days hard sort of thing, and usually you have to walk, and for that, certain people who have not had any exercise before going there, 4 to 6 weeks before they start having exercise, it's about 4 miles you must be able to walk without getting tired. And if you're doing it on the very first day, lactic acidosis, we call it in medical terms, you get in your leg, you won't be able to walk the next day. So best thing is you must walk every day 3 to 4 miles. Gradually you build your body that you can go for 6 miles without getting tired. That's very, very important. When I was on the delegation in 2002, I have seen a lot of patients having that problem. And the next day, they can't walk because they got all electricity in their leg. They were unable to perform the rest of the 4 days. So that's what one of the factors you must see that. Now finally, while I'm talking over there, all these sort of things, this is, I'm telling you short because the government gave me very kindly 7 to 10 minutes, so I can finish it that time, maybe earlier than that. So another thing we talk about general health, like smoking, we advise smoking is not good. In any case for anybody, any human being, smoking is bad, it's bad. Not only if I smoke here, in 5 minutes smoke will go away, but smoke doesn't go away. I'm smoking, I'm actively smoking, I'm an active smoker. When they disappear and everybody here, they are passively smoking, they are breathing in the same atmosphere. When you open the door, the smoke goes to other room. So in the house, it's not you're smoking in one room, you're smoking in one room, and it goes all the room in the house, your children, your wife, everybody smoking. And there is a lot of death yearly due to passive smoking. Lung cancer is a common thing over there. So we advise on these meetings about the smoking. We also talk about this hepatitis. Everybody knows hepatitis is killer, especially the hepatitis B and C. How we get this hepatitis? When you go on the head, there you have to remove your hair. Whenever you want to remove your hair, don't use the razor blade which is used by everybody. You have to get the new razor blade by your head. And that's the way you can protect getting the hepatitis from other patients. It's not only you are there, it's there all over the world, different countries, that people come over there, some of them, they have hepatitis B or C, so you have to protect it. You should not get that sort of thing. So that's the way you protect them. If you're getting a shaving done, must make sure you got the new blade in the razor blade and it is not used one by other people. So these are the measures we tell them not to have the hepatitis. And also we talk about, because we're living in England, and we every year know, the year is starting, about flu vaccination, especially those elderly people and those people who are at risk like diabetes, asthma, COPD. They must get flu injection when you're. This is general advice we're giving to people over here. And the most serious thing which is important for every Haji before they go there, they must have that injection, that's the meningitis injection, which Dr. Razak said is going to talk about. That sort of thing, talk we give here in small, in short way, and when you are talking to the big gathering in Birmingham, before the Hajis go there, we tell every detail how they can protect their health while they are in Saudi Arabia. Thank you very much.
But he is the man who I'm going to ask to talk about meningitis now.
Thank you, my lord. May I say, to start with, that, my lord, it will be a great pleasure indeed to offer my humble services yet again this year, here itself. My lord, distinguished guests, ladies and gentlemen, meningitis is a well-known, notorious killer disease which respects no national or international boundaries. It is highly infectious and rapidly spreads from one person to another. It is literally incurable, and the fertility rate is very high indeed. Those few who do manage to survive through most intensive hospital treatment often end up with all the miserable sequelae, such as damage to the brain, kidneys, lungs, and the limbs, etc. Sadly, their quality of life is very poor indeed. Please allow me to quote one example to dilate upon this particular point, if I may. Some 2 years ago, a 4-year-old girl was brought to my surgery as an emergency. A view of the history and the clinical examination I most strongly suspected meningitis. Immediate hospital admission via an ambulance was organized by me. It took several weeks of 24 hours intensive hospital treatment and care to save her life. Now, this little sweetie has grown up now to be 6 years in age. But what has happened? I was indeed appalled the other day to have a look at her. And I'd like to share my experience with you, my lord, ladies and gentlemen. This will actually focus upon the importance and significance of a meningitis injection before you ever think of going to Hajj Umrah. Now, this little sweetie, as I say, has now grown up to 6 years in age. She's living, but with a right blind eye, a very badly scarred face in spite of plastic surgery on 2 to 3 occasions. Her right forearm has been amputated to the elbow level. Her left foot has been amputated to the ankle level. And all this just because to save her precious life. What a quality of life. Just kindly think and ponder upon. The parents are extremely grateful. They're extremely grateful. And so am I. But then nevertheless, we feel extremely sad at this scenario. So ladies and gentlemen, this was a typical example which hopefully has given you briefly, precisely, but the relevant information highlighting the significance of injection, vaccination against meningitis, that is. I must emphasize here now that all this misery, the severity and death are preventable, my lord. They are preventable. How? By a simple single meningitis vaccine available from your doctor's surgery and from the various vaccination centers up and down the country. I do note my sister's point with regard to the fees. Yes, unfortunately, there seems to be a certain amount of variation, in fact, considerable variation when it comes to the charges. But may I say, the reality is that the British Medical Association every year reviews the private guidelines, in fact, for the private part of the medical practice. And these guidelines are only for guidance and not sort of obligatory on the part of the GPs. Speaking for myself, I do not charge anything at all for my patients, but a reasonable fees charged perhaps would be in the region of 50 to 20 pounds. Though extreme exceptions have been reported to myself, where 75 pounds have been charged. I can only sympathize and perhaps apologize. Now, over 2 million people will converge upon Makkah in Saudi Arabia from all over the world, including about 25,000 from Britain, to perform Hajj this year. The Association of British Hajj, a national Hajj-specific organization, organizes high-profile publicity campaigns throughout the year via the press and electronic media, by special TV programs on various channels, and also by organizing seminars, educational training programs, and distributing multilingual literature to raise awareness of pre-travel health and safety issues and meningitis prevention amongst prospective Hajj pilgrims, as just mentioned a moment ago. Here, I wish to extend our deep sense of appreciation and gratitude to the ladies and gentlemen of the print and electronic media who are present over here. And of course, those who are not, but do provide us the courtesy of coverage for this noble cause up and down the country. Thank you once again, ladies and gentlemen. Now, every year, an increasing number of people out of a population of 2 million Muslims in the UK will travel to Saudi Arabia. Since it will be an ongoing process, There is a desperate need to protect these travelers to avoid risk of any outbreak of meningitis, and for that matter, any other infectious disease, through the Hajj returnees in the UK, which in fact, my Lord, as perhaps you would kindly recall, did happen in year 2000, where about 40 cases of meningitis were isolated, and sadly 8 died despite all the intensive treatment. Well, here's a classical example. Now, the Association of British Hajj has been committed to this noble cause to provide such dedicated services to our countrymen, and continues to serve with a sense of genuine pride, if I may say so. In conclusion, ladies and gentlemen, the key message to take home from today's event, may I have your kind attention for just a moment, please. Meningitis is a sure killer. Save yourself by timely action. Get vaccinated today. I repeat, get vaccinated today, because tomorrow might be too late, or indeed, who knows, it might never ever come at all. I'd like to thank you very much indeed, Your Lordship. Ladies and gentlemen, thank you.
Dr. Saab, if you'd like to say something about Hajj.
Bismillahirrahmanirrahim. My Lord, distinguished members of Parliament, ladies and gentlemen. First of all, let me just thank the ABH for the wonderful arrangement that they always make. And it's a pleasure and my privilege that I have been asked to come here today. Dr. Bhatti and my dear colleague here, and Dr. Hussain. I'm a medical doctor by profession, but I changed it later on.
Welcome, sir.
They have highlighted the various diseases which can sort of make the Hajj not a pleasant experience. Like, I personally suffer from them. Actually, lactic acidosis is one of them. Dr. Bhatti has talked about that. Dr. Sain has spoken about meningitis in great detail. And tuberculosis is an active killer, actually. And the other day I was listening to TV, Lord Ahmed, and they said one active meningitis patient can infect 10 other people. So when you are in when you have 3 million people, and coming from all over the world, actually, there is a high risk actually involved there. Now, I would also like to thank Khalid Parvez and his colleagues for arranging this meeting once again. And I know Birmingham is not on the tourist map this year, but we have one such organization which will put it on the map again, if not for touristic purpose, for other things. So, and with this I'd like to thank you very much, and I hope all those people who go on Hajj wish them Hajj Mubarak.
Thank you very much. Now we have Sister Batula Toma, who is running a project in Leicester. Is it Leicester? Mm-hmm. And would like you to say a few words. Bismillah.
Bismillah. Thank you. Good evening, good afternoon, everybody. Assalamu alaikum. As the director of the New Muslims Project at the Islamic Foundation in Markfield in Leicester, and also as a tour guide for Dome Tours, located here in London, which I'm sure you're all aware is the leading tour operator for Hajj Umrah. I just wanted to address some of the issues to do with women. It is in fact a fact that when it comes to Hajj, Islam's 5th pillar, as with some of the other obligatory pillars in Islam, the attitudes towards facilitating the way, means and performance of Hajj is, to say the least, an afterthought. And I think that's borne out here today by the presence of so very few women at this event. Where it is provided, the facilitation is often lacking, and the information, support necessary for preparation and the performance of a good and meaningful Hajj is seriously lacking. Women are obliged, for the most part, to incorporate cultural and theological verdicts, which mean that which demand that they can only travel with a mahram. I would personally have to have some discussion about that. And particularly for converts to Islam, this is not possible. They have neither brothers, uncles, fathers, or male relatives who can accompany them. And so I would ask on the people here present, if they are approached by female converts, we can provide them with Shahada certificates to present to the Saudi embassy in order to secure a visa, and also a letter to confirm that they are a convert and that they don't actually have any other male relatives to take them. So I think they should be taken on that basis. Also, I think, I'm sure you all know, or I'm not sure that you know, that women over the age of 45 are allowed or accepted, as far as I'm aware, to travel on Hajj unaccompanied by a male mahram. I myself have fallen into that category, and it looks that the age of 45 for women, Muslim women, is their sell-by date. So when you've gone past your sell-by date, you're allowed to travel without a mahram. I would hope that all of the tour operators are putting that into operation and making sure that women of that age range are accepted. However, be that as it may, it's vitally important that information of the practical, theological and spiritual aspects of Hajj are related to our brothers and sisters, and which do not get conveyed because, generally speaking, most of the tour operators speak to the men. Now that means that much of the information that is essential to the women is not filtered down. So I think it's important that messages, procedures, directions, important information on the process of Hajj and the practical logistics of the general travel incurred, what to bring, what to wear, etc., are not relayed to the women. And I think it's important that these should be, and that all tour operators who are represented here and outside should have an outline or some sort of written documents in various different languages to present to all of those who are going on Hajj in order so that they will be prepared properly. Arriving in the Hajj terminal and the wait and eventual arrival in Mecca is awesome in itself, but much less so if you are well informed and well prepared in advance. So it goes without saying that right throughout the Hajj there should be some serious preparation done. And I would seriously advise the Hajj group here that induction programs are an absolute must, and perhaps there should be some sort of way of sort of securing some written documentation that each person who is participating in the Hajj, both male and female, have attended an induction program. Well-educated, informed and trusted female guides should be an obligatory and essential addition to all Hajj groups. They should work with the entire management, male and female, and other essential staff, in sort of discussing and planning meetings before, during and after the Hajj. Making sure that this impacts positively on the entire group, both male and female, in the full and frank realization that one is obliged to perform Hajj only once in a lifetime, and for the vast majority, given the current and what can only be described as blistering cost of Hajj, this may well be that one and only time for the vast majority of your participants. It's said in the metro today that the train service here in the UK is only for the rich because of the rise in prices. It seems that Hajj is fast becoming only for the rich. And I would call on all the tour operators here today and the people from the various different embassies and so on, that there should be some investigation into the rising cost of Hajj, and some kind of cap should be put on it in order to... Can I just say, just a final thing, that all of us should be well aware of the simplifications, the safety, the extensions, and I'm talking about the theological extensions, privileges and so on, that are available to us through the Islamic theology throughout the Hajj, and that we should make it easy on everyone. And that all of the Hajj companies should provide clear guidelines with a list of authentic books which should be part of the preparatory reading for Hajjis on their way. So really I just wanted to flag up the importance of the women in Hajj and the importance of facilitating and helping and supporting them through the Hajj, and really sort of asking you to please accommodate them as best you can. Thank you.
Sister Yasmin Qureshi, thank you very much. I know you have to go. Sister Batul, that was a very fascinating and very good speech, because you've said some things that obviously I feel very strong, and that's why I talked about the price earlier on, and I'm glad that you did, and that's why you got a round of applause. Although there are certain other issues that have other implications in terms of guides at Hajj and female guides, etc. Because whilst the intention is good, unfortunately we live in a real world and there are lots of problems that can arise from it, and it probably needs thinking about, but it's certainly very, very good. No, of course you have every right to disagree with me. Now I've been told that there are some lucky people here. These are not Oscars as such, but they are wonderful awards that are being given by the British Judge Association. I cannot tell you who the recipients are, but I'm going to ask Dr. Saab, Dr. Raza Hussain Saab, to take over from here now to mention who these people are and why they're being given awards.
Thank you, my lord, distinguished guests, ladies and gentlemen. As you are by now very well aware that the Association of British Hajj is totally dedicated and committed to provide all the necessary up-to-date knowledge and information to the British Hajj and Umrah pilgrims. This helps to facilitate their welfare and well-being before, during, and after the Hajj. This is a mammoth task indeed, and cannot be fully achieved without dedicated voluntary help and support by our countrymen up and down the country. We at the ABH most gratefully acknowledge them as friends of the Association of British Hajj. That is the title we have chosen for them. Friends of the Association of British Hajj, UK. In recognition of their magnificent services, the ABH have decided to present special awards to 2 such friends each year on ongoing basis, inshallah. Today's selected friends of the ABH are both well respected in the community for their integrity, sincerity, loyalty, reliability, and utter dedication to their community voluntary services and noble cause of the ABH. Ladies and gentlemen, please put your hands together to congratulate today's chosen 2 friends of ABH, Mr. Sarbiland Muslim Sheikh and Mr. Muzammil Haq. Please.
बिस्मिल्लाहिर्रहमानिर्रहीम। मैं इस काबिल तो नहीं हूँ, मैं आप लोगों का बहुत शुक्रगुजार हूँ कि मुझे आपने ज़्यादा समझा, मुझे अवार्ड दिया। अल्लाह आपको सबको खुश रखे और सब मुसलमानों के लिए मैं दुआ करता हूँ कि इस बात माफ़ से।
माशाअल्लाह, बहुत शुक्रिया। Would you like to say something?
Assalamu alaikum. This all praise goes to Allah, the Almighty. I am a very humble person. I am trying to do whatever for the cause of Islam and the Muslims community. It is my duty as a Muslims to inform and educate the people who are going for Hajj, and that's what I am doing. It is my duty. I am doing that.
Thank you so much. Now go back to your seats. Thank you so much. The chairman of the Association of British Hajj, my very good friend and brother Javed Aziz has travelled all the way from UAE, from Dubai, to come and say thank you to you. So the floor is yours.
Thank you, Lada. Can I thank you, Brother Ibrahim from Southern Embassy, for being here. Can I thank Dr. Said myself, Consul General of Pakistan Embassy. Can I thank you, all the media, printing, electronics media, for being here and giving us coverage. We need your help to convey our message. And can I thank all the brothers and sisters who are representing all the organizations for being here, brother from Trading, and thank you for here, and we will be needing your help and guidance to improve the facilities for British Muslims. And last but not least, our chaplain and host, Ahmed. Without you, sir, this occasion never would take place, and I'm really grateful for your help. Thank you.
Thank you very much.